All right, so I'm going to interrupt you guys real quick. You'll have time to fill those out at the end. We just want to, a couple things make sure you sign in first if you haven't already signed in. There's a sign-in sheet coming around. There should be 3 different papers you all should have: an emergency contact sheet, the volunteer responsibility sheet, and then also a volunteer form as well. So just make sure you have all 3 and have filled out the 2 of them before you leave tonight. All right. So my name is Jennifer. I'm one of the technicians here. Hi. Thank you all for coming. Sorry it's been rescheduled and moved and everything like that. It's been crazy trying to get this organized for some reason this year. Olivia is our tech that's actually going to be taking over the program, so I'm kind of handing the reins over to her. So she's going to be your contact person and that sort of thing if you have questions. I'm just kind of doing the orientation one last time here so she can learn it, and then kind of handing over the reins to her, and she's going to take over the program for me. So a couple things, we're going to go over the volunteer responsibility sheet first, and then we'll go over the volunteer form as well, so that way you know what you're signing, because you don't want to just sign on the dotted line. And then we're going to do a quick session on animal behavior, because I really want you guys to be comfortable and familiar with dog and feline body language before you're with cats and dogs. And then you get to tour the ICU real quick, which makes it fun. So that way you know where you're going, and oncology, sorry. That way you know where you're going when you start to volunteer, all right? So just a little bit about this program. This program has actually almost been going on for 10 years, which is quite impressive, almost as long as I've been here. We started this program when, way back when in our ICU, bless you, we had some patients that were really anxious in their cages, some huskies that like to serenade us for hours upon hours, some patients that when they first came into the hospital were doing really well, and then after you pull them out of the cage every 4 hours and get a temperature on them rectally and stick them with needles, they tend to get a little grumpy. So we initially kind of copied off of our full sitting program, which was we had volunteers, usually pre-vet club volunteers or technician actually. Technicians that were in school, volunteers come in and just sit with baby foals. They no longer offer that program, but we're like, hey, why can't we steal that idea for small animal for our ICU patients? Because being a technician or former technician in ICU, I can tell you it's not fun having the husky serenade you for 10 hours. That can kind of give you a little bit of a headache. So we decided, hey, let's try it out. So we implemented the program. It's gone phenomenal. We thank you guys for volunteering. It's a lot of fun for the ICU techs, our patients, and also we've expanded out to oncology. So it's a lot of fun for them and their patients as well. And it's a lot of fun for you guys because you get to interact with dogs and cats. You get to see our awesome ICU. You guys are lucky because you're in the new, brand new, shiny ICU. And then oncology, those that are volunteering for oncology, those patients typically come back on a weekly, monthly basis. So you actually will get to know some of those patients, and they'll recognize you, you'll recognize them, which makes it really special as well. So a few things to think about when you're volunteer for this program. So if you are at all faint of heart, which I means if you see blood and you pass out, thank you, but no thank you. You might see blood when you're volunteering, especially if you're in ICU. If you get nauseous with somebody, a patient, not a human, vomiting or diarrhea, then thank you, but no thank you, because you're probably almost 100% guaranteed to see that on ICU. ICU, you might also see some patients that are hooked up to ventilators. We ventilate patients just like they do in human medicine. We also do dialysis on our patients as well. You might see a patient actually code, which also means their heart stops or they stop breathing. And you might see something like that in ICU. All right, so I just like to prepare you guys ahead of time so it doesn't take you by shock when it does happen. The best thing you can do is just get out of the way. All right, and let the technicians and the doctors do what they need to do, okay? 9 times out of 10, you're not going to be sitting with those kind of patients because they're usually not aware of their surroundings. but it may happen. You might see something like that in the ICU. For oncology, those patients, obviously, cancer. They all have cancer. They're getting chemo treatments. You will not be exposed to chemo. They usually give all those drugs IV, and the technician does it in another room. So we keep you as safe as possible. But if any of you are pregnant, we do ask you to let us know. We take extra precautions just in case for anybody that is pregnant. With those patients, you generally just sit with them. You might see a patient getting an IV. You might see a patient getting blood draw in there as well. So that's where you might come across the blood. So hopefully you're not faint of heart, as I like to call it, with those situations, considering you want to be a veterinarian. And you will see that stuff. But I just like to warn you ahead of time. It's okay if it makes you a little nauseous, but if you have a history of passing out, thank you, but no thank you. Because we don't want to call the paramedics for you. Because if you pass out, we have to call the paramedics. All right? Just a forewarning. So first, we're going to go down this responsibility sheet, so you guys kind of know what that is, that entails. And then we will go over the form that you have to fill out. So the responsibilities, so basically you guys are there to walk our stable patients, stable meaning that they can get up, they can move around, they can go outside for a walk, that they're not hooked up to anything that will not allow them to go outside. For ICU and oncology, they're actually next door neighbors, which is really nice, and they have the same walking area. So it's literally right behind them, but literally down at the end of the hall. You can't miss it. So it's AstroTurf. And it's, I don't know if you guys have seen what they did, the big campaign here with the Michigan fire hydrant that the dogs were peeing on. That's where you'll be. So it's kind of fun. A lot of people like to take pictures of that fire hydrant. You cannot take pictures of patients, though, peeing on the fire hydrant. You can take pictures of the fire hydrant, but not patients. So that's where you'll be walking the patients. The ICU techs, if they're on an IV, will disconnect your patient and re-hook your patient back up. Okay, please do not attempt to disconnect any patient from any IV set. The ONCO patients should not have IVs in, and if they do, they typically aren't receiving fluids, so they already have a cap on it and they're ready, all set to go. All the dogs must be on a leash, please. We don't know these dogs. They don't know you. No matter if they seem like they would listen, we don't trust them. Okay, so we always keep them on a leash, and we never let them come nose-to-nose contact with another dog. Okay, you never know how they're going to react. We're in a hospital environment. It's a very stressful hospital environment. Once again, they don't know you. You don't know them. They don't know the other dog. So never, ever, ever any nose-to-nose contact. Okay, that's very important. Sometimes people will just open the door when they're walking a dog as if you're trying to come in, and that might happen. So it's good to just intervene and pull them back right away. You can brush the dogs and cats if they like it. Please don't force it upon them if they do not like it. But there will be brushes there for you guys to use if you would like. And then just basically sit with them, give attention to them, just pet them. All right. Some of our patients just literally just want somebody just to be near them. That just makes them really much more comfortable in the hospital. All right. So a couple things to know and to expect when you show up for your shift. So I'm not expecting you to remember where the ICU and oncology rooms are, your first, second, maybe not even your third shift, and that's okay. What you're going to do is just come in the main hospital entrance. All right. You're locked if you go up this way. You're probably locked out here. Somebody probably had to let you guys in here. And they're even going to get even more locked down when we open our new lobby in like 2 months. So you're going to come in the main hospital entrance in the small animal side and just go up to our front desk, say, hey, I'm here with the Pet City program. I'm here to volunteer with either oncology or ICU. Make sure you tell them specifically what department you're with, all right? Because that depends on who they call. Right? There are 2 separate rooms. Yes, they're neighbors, but 2 separate rooms, totally different set of people, all right? So just say, hey, I'm here for ICU pet sitting, or hey, I'm here for oncology pet sitting. They'll either call someone will come up and get you, or we actually have a lobby liaison. Her name is Frances. She's really sweet. If she has time, she'll walk you guys back there. Once you feel comfortable going back to ICU, or if you've ever been in this hospital before, if you volunteered here before, you know where ICU is, you know where oncology is, you're more than welcome to just walk right back. Okay, that's why I say your first, second, maybe third time, you're probably not going to be as comfortable. But once you get comfortable, you just walk on back. You don't have to check in the front desk. All right? And I'll show you the way to walk back there today when we do our quick tour. So that way you can kind of be familiar with it. I'm sure day one you're going to be so nervous that you're like, ah! But that's okay. You're allowed to be. All right? When you come into ICU or into oncology, just let the technicians know that you are there with the pre-vet club and you're there to volunteer. All technicians will be in this blue. Okay? So just look for somebody that looks like me and has this emblem on their scrubs. If they don't have this emblem, that means that they're a technician student, so they probably don't know as much. Basically, just look for all blue with a technician emblem on it, okay? And then they will know how to help you. Just let them know that you're here for your shift, and they'll get you all set up and show you where to put your book bag, if you have a coat, where to hang your coat, and then they'll also show you where the binder is. Once you get comfortable, you can just walk on in, hang your coat up, put your book bag away, get out the binder, sign in, and then go find a tech and say, who can I sit with? But on your first couple days, I'm expecting it's just easier for you guys to find a technician, and then they'll get you all set up. All right? In ICU, there's an orange binder. Olivia, can you hold that up? There's an orange binder, but that's what you'll use. In oncology, there's a purple binder, which I don't have, which we don't have. I didn't grab it. That's wrong. So when you get there, you always want to make sure you sign in, and then you always want to make sure you sign out and have someone initial that for you. And the reason I do that is to prove that you actually came in and volunteered. It hasn't happened for a few years, but I did have some people take advantage of, they said they came in and they never did and then wanted a recommendation letter. And I said, okay? So I needed proof that you were there and or you weren't there, so that's why we have you sign in and out, okay? There will be badges for you guys to wear or stickers to wear. We're getting that figured out right now, so just make sure you put that on you so that way everybody knows who you are. In the past, we've had some of our faculty mistake volunteers for students, and they've handed the student a medication before and give that to that doc. You're not allowed to do that, okay? So we're going to have name badges for you guys so that way everybody knows who you are and knows not to hand you an injection of a medication to give to a patient, okay? The shifts are 1 hour long. You must sign in and out. We've kind of already talked about that. The schedule, you guys will get emailed to you. Oh, yeah. There you go. But I also have it printed out in the binders. So if you ever have a question about it and you forget, you can't find it, it'll be in the binders for you guys as well. All right. As far as calling off, so we have a 3 strikes and you're out policy. So we give you 3 chances that you can call off because we understand everybody gets sick. Okay? That happens. Or something comes up. I've had some people interview for vet schools and they had to go fly away and they couldn't be here for volunteering, family emergencies, that sort of thing. All right? So you get 3 strikes, and that's it. We've had to have people take advantage of this in the past, so that's why we implemented that 3-strike rule. This rule does not apply. I'm going to say that again. Does not apply, so that way Olivia doesn't get all these emails, to your final exams. So usually that's a week or 2 that you guys take finals. Game days. So if you're volunteering on Saturdays and it's a home game, do not come in. Because this hospital is even more on lockdown because we've had some drunk people try to come in. So we really locked this hospital down, and getting here is hard as well. That you guys probably don't drive, but just with all the crowds and everything. So if you volunteer on a Saturday home game, I'm not expecting you to be here. Okay, so don't bother showing up. If it's bad weather outside, so we're starting to go into wintertime, if it's even 5 below outside, you don't have to bother coming in. I'd rather you not walk all the way here in 30 degrees below 0 and get sick. Okay, so if it's really nasty outside, snowing outside, icy outside, if the university closes, anything like that, we'd rather you not come in. Okay, because we understand you're volunteering. And we want to keep you nice and healthy for the reason why you're here is to go to school and go to classes, all right? The other thing is holidays. So if it's a holiday weekend, I'm not expecting you to be here. Thanksgiving, so that Wednesday, Thursday, Friday, Saturday, Sunday, whenever the school is off, not expecting you to be here. Okay, does that make sense? Okay. Easter weekend I also count as a holiday. I know the university doesn't really, but that Saturday, Sunday, I'm not expecting anybody to be here either. Okay? All right. As far as other things you can do with or things to fill out, sorry, I skipped one. There is emergency contact information sheet on there, so that's in case something happens to you here, we know who to contact, and there's 2 people on there. It should be people that know who you are, first of all, know somewhat of your medical history, so they're like, yeah, that person has an allergy to this, this, and this, they have an EpiPen in their backpack, make sure you give it, or that can come to the hospital, or something like that. Okay, so we give you 2 people to put on there. We've never had to use this, knock on wood, but just in case some weird thing happens, like you're allergic to latex, and we might have something with latex here, which we typically don't, but just in case, you're allergic to peanuts and you didn't know this, and a patient's eating peanut butter. So just in case we have you fill out, everybody needs to fill that out and then hand it back to me today. The other thing is we have a box of toys in the ICU and also in oncology. Toys meaning brushes, your brushes are going to be in there, and we have what's called Kongs. I don't know if any of you have any dogs that know what a Kong is. They're the big black or red rubber things. We have those in there as well that you can put some treats in and give to a patient. We also have some cat toys. Most of our cats here will not play with that. But, you know, sometimes we get a kitten. A kitten might play with it in ICU. But that's about it. So in that box, you're more than welcome. Help yourself to whatever's in there for whatever patient you want to sit with. If you have a Kong and you're going to leave it in the cage, which is fine, just make sure you let an ICU tech know or ONCO tech know, hey, I'm just leaving so-and-so's Kong in their cage because they haven't finished eating what's inside. If they've eaten everything inside and they're done with it, there are sinks in ICU and in oncology, just throw it in the sink, okay? And then one of the technicians will rinse it out and put it in the dishwasher. You don't have to wash it. You can just throw it in the sink for us, all right? We do have a dress code for this. You need to wear scrubs and closed-toed shoes, okay? If you show up in flip-flops when it started, well, it's nice weather right now, but usually I hit this in the springtime, I will send you home. Or Olivia will send you home, or one of the techs will send you home. OSHA, we cannot have you in open-toed shoes here, okay? It's an OSHA rule. Heaven forbid something fall on your foot, break a toe, that sort of thing. We have things in ICU that can be infectious and zoonotic, meaning people can get it. We just cannot have you in open-toed shoes, so please do not wear open-toed shoes when you come to volunteer. Scrubs, I don't care what kind you want to get, what colors you want to get, just don't get navy blue, because you will be mistaken for a technician.
Or seal. Right?
Or seal. Seal is actually what the vet students wear, okay? So you want to make sure you're not matching them, because then people will start handing you stuff to do. And you want to make sure you're not matching us. So I know in 1st through 3rd year vet school, you're allowed to wear whatever color you want. 4th year, it has to be the seal, okay? So I don't care if you want to prints, no prints, solids, whatever. Amazon, if you get together with some of your friends, they sometimes have scrubs, like a couple of them, like groupings of scrubs for pretty cheap. So you can go on Amazon and get them. Target at Lennox used to have them. I don't know if they have them anymore since we're so close to the med school. I think like Buckeye Corner has OSU. If you really want to represent OSU, they have like OSU scrubs and stuff like that. They're kind of expensive. But if you're planning on coming into vet school and you're going to be using them for 5-6 years, kind of worth your money. All right. So just make sure you're wearing scrubs and then also closed-toed shoes. If you work at a small animal practice or a large animal practice, I don't know if any of you work at a veterinary hospital now. Do not wear your scrubs from that hospital here. Do not wear your scrubs here to that hospital. Okay? Each hospital has their own bugs, and we want to keep OSU bugs here and that hospital's bugs there. Okay? So just make sure you switch out your scrubs. Shoes, just make sure they're somewhat clean and don't have dry blood all over them. Right? The other thing is when you sit with a patient, so in ICU and oncology, you ask the tech, hey, who can I sit with today? Who needs attention? If you want to, in your hour, sit with 4 patients every 15 minutes. If you want to sit with 1 patient all hour. If you want to sit with 2 patients, 30 minutes each. I don't care. They don't care. You can divvy up how much as you want. Each patient, though, needs to have a little purple card filled out. And it's just a little slip. It's purple paper. You can't miss it. It's actually going to be in the binder there. It'll be in the ICU binder. It'll be in the oncology binder. And all you do is just basically grab it and fill it out.
That's it, but it's not purple.
It's
this one, but it's not purple. This will be purple.
So basically, you just fill it out. Say what you did with that pet while you sat with them. Okay. I put some examples down here, so you can say I took Fluffy for a long walk. I sat with Fluffy, brushed Fluffy, I petted Fluffy, or I fed Fluffy. Some bad examples, because remember, these little purple sheets we're actually giving to the owners of that animal, all right? Please do not put anything on there like Fluffy was really boring. Or I literally had this happen, I think I put it on here. I told Fluffy scary stories, all right? Please do not put that on there because owners are seeing this and reading this, all right? And remember, petted is not a word. Just my grammar is coming out there. But just write a little note. It doesn't have to be this long, elaborate novel. Just whatever you did with Fluffy. Okay? If you notice, though, when you come into ICU, that one patient has a whole lot of purple slips and the other patients do not, please go to those other patients and sit with them. Usually, I can almost guarantee you, walking into ICU and seeing a ton of purple slips, it's probably cute and fluffy, and that's why everybody wants to sit with them. And I know everybody likes the cute and fluffy guys, but the old guys and not so cute guys still need attention too. Okay, so just remember that. Keep that in mind. In between sitting with patients, you must wash your hands, please. There are sinks in ICU and oncology with soap there. Really easy to find those, but just make sure you're washing your hands in between. The other big thing is you ever, when you're sitting with a patient in a top cage, walk away from that cage with that door open. Okay? Never, ever walk away from that cage with the door open. Okay? They will move quick, even if you think they will not. So if you need to step away, please shut that door and make sure it latches. Okay? Don't ever step away, even if it's like a foot. Don't do it. Just don't do it. Okay? The same way if you have a patient in the bottom cage and they try to push past you and bolt out, just don't let them, or don't sit with that patient. If they're so anxious that they're pushing you, bolting out, and it's a fight for you to even sit with them, then you can either ask the ICU tech, can I just disconnect them from the catheter and can they be offloaded for a little bit while I walk them, or just don't sit with that patient. We had one instance where a person just let a dog bolt out and then stepped on their IV line to stop the patient from running away and ripped out their IV catheter. All right, so let's not do that. If they seem like they want to knock you over and get out of the cage, then just don't sit with them. Or, like I said, ask the ICU tech and they can disconnect them and you can maybe take them for a walk. Okay? All right. What questions do you guys have so far? Olivia's information is at the bottom there. So her first and last name, her email, cell phone number. Please do not use and abuse that cell phone number. That's for emergency purposes only. So if you know ahead of time that you're going to miss a shift, just send her an email. If you wake up, are sick that morning, can't make it later that day, just send her an email. Email is preferred, but that is there just in case of emergency. Okay? What questions do you guys have? Because I know there's a lot of info. Yeah.
So we don't have to come in during finals, but if we want to,
if you need a nice break, go for it. I've had some people do that. They're like, I need to get away from the bugs. I just need to pet something cute. That's fine. You can do that. It's not expected of you, though, because you're here for school, so grades are really important.
Yes, is that the same for Saturdays with game days, or is that just strictly like do not come game days?
Well, if you want to, you can. I don't think you'll be able to get in. That's the problem.
Oh, okay.
Yes, so I would just not come. You might waste 20 minutes walking here and then find that you can't get in the building, and then you have to turn around and walk around. So when I say this building is on lockdown on game days, it is seriously, you can ask Olivia, seriously on lockdown to where even technicians getting in the building is hard for us because whoever designed a stadium right across the street from a veterinary hospital close to a human hospital was not that smart. Okay? So we have a lot of people out here tailgating everywhere all around us, and sometimes those people party hard. Okay? All right, what other questions?
Are there any of the days that are like don't come in versus just like?
No, just that. Yeah, it's just mainly the game day. I don't think you're gonna come in, and then if you are sick, please don't come in. Like, please do not come in. Because this place, I call it a petri dish on purpose. Because if one person comes in sick with a fever, we all get it. Okay, so it's okay. You have 3 strikes and you're out. I said not including the game days, not including holidays, not including finals. All right. So if you're sick, please do not come in. We beg of you. And if you come in sick, we'll probably send you home. What questions do you guys have? These good questions.
Yeah. When does like the semester consider ended?
The start of finals.
Okay. Yeah. What other questions? Yeah.
So seriously, you don't want us to come in for bad weather days. Do you want us to email? Or is that too
Do you want
many
emails or no?
I don't want you to
no,
be like
you
bombarded.
know, I don't think so. If it's bad weather, I'll just pay attention to the weather, and if it's bad weather, I'll expect you're not going to be here. So don't worry about emailing me if it's nasty.
Pretty much know when it's bad weather.
Yeah.
It's usually
Oh,
9
cold
times out of
snap.
10 when it's really nasty outside. You have to work. That's how ICU goes.
Yeah.
If it's nasty outside, that's your day to work.
Yep.
'Cause I shouldn't say we anymore, but ICU technicians are considered essential employees, so they have to be here no matter what. You could have like a 10-foot blizzard and you still have to show up for work. So. All right, what other questions do you guys have? Comfortable with everything so far? Okay, not too overwhelming. It's fun.
Yeah. What if like we might be late? Do we email
No,
or
you
do
don't
we
have to.
Okay.
That's fine. That's not a problem at all. It's the no showing up.
Well, with that said, try to be on time.
Yes.
Please.
Don't make a habit of it. But yes, if you're running late, miss a bus, that's fine.
Or if you're early and there's someone already pet sitting in the ICU the shift before you, they usually can't handle more than one person.
Correct.
So don't come in and try to pet dogs with them.
Just kind of wait your turn. No, just kidding.
Yeah.
All right, good questions. What other questions do you guys have? Good. If you think of more as we're going, just holler at me. All right, next, volunteer sheet. So this is just saying that you are volunteering here. I'm assuming everybody here is 18 years of age and over. Awesome. So this is just saying, giving your information that you're volunteering here, that you will not hold the university liable for anything that might happen to you. So if you trip over a nail and break your arm, you can't hold the university responsible and cannot sue the university. All right? So I just need your information on the front. Mailing where you are living now, here on campus, okay? Not where you live. Where you live now. Does that make sense? Like, how do I say that? The back I already have filled out, so you guys don't have to worry about it. You just need to fill out the front. Okay? And I just need that at the end of today. Alright, so if you guys are feeling comfortable, we're going to move on quick to our behavior stuff. This is going to be really quick. I say it's really quick and dirty. So this is just a really quick overall of feline. We're mostly going to concentrate on canine because it's mostly what you're going to be sitting with, okay? Most cats in the hospital are not happy cats unless they're on really good drugs. So we tend to not have as many people sit with our kitty cats as much as the dogs. And cats typically don't like people all up in their face, petting them. At home, yes. In the hospital, it's a completely different story, okay? So we're going to focus more on canine and a little bit on feline, depends on the time. We'll do a quick tour and then we'll set you guys free, all right? So let me make sure this comes up. Which lights are which? There we go.
They come back on.
No.
I think they're motion sensor.
I think we can handle that. Everybody can see, right? All right. And then, where is the? It's been a while since I've been in this room. Usually in the county room where it's all such a thing. Okay. Let's get it going down here. So this is actually one of. Oh, go away. So this is actually one of the presentations that our veterinary behaviorist here gives, and then our behaviorist that we used to have work here, she no longer works here, gives. And then they, since I have listened to it so many times, I now kind of do this presentation for them. So this is actually done by Dr. Megan Heron and Dr. Tracy Schreier, which are both very awesome. Oh, wait. There we go. So we're going to talk about canine body language first. It's really important for you guys to understand body language because obviously our dog friends can't talk to us. They can't say, hey, I'm the type of person that I don't like being touched, so please don't touch me. Or they can't say, hey, you look really scary right now, can you please stay far away? Or they can't say, hey, I really don't like you drawing my blood, and I might have to bite you if you keep doing this. All right? So they can't tell us these things. So what we do, because they are telling us, but in their own way, we look at their body language. So body language is really important to read body language, knowing how to read body language, and canine and feline, all right? Because they're telling us, but just not with their words, all right? So we're just going to talk about the different types of body language. So veterinary students here learn red, yellow, green. When they go in to assess a patient, get a history from a patient, they automatically have to tell us, is that patient red, yellow, green, why it's red, yellow, green, and what makes it red, yellow, green. Okay? So you guys are going to learn all that today and be able to do that yourselves. So we call the first patient green. So this is our relaxed patient. So this is the patient in the hospital setting. Now this can apply outside hospital setting as well. But in the hospital setting, I perceive this environment to be non-threatening. Okay? So how we perceive that and how the patient tells us is we look at their body language. So we look at their posture. They're really relaxed. Their weight is carried evenly. You see this guy, 4 legs? Weight is distributed evenly on those 4 legs. All right? We may see a little play bow. I don't know if you guys have ever seen that before. Where they're like, hi! They play bow, and then they get that little wiggle going on. Everybody, when I say green puppy, our students do this all the time, everybody goes to that cute little lab puppy. That's like, ah! If you guys have ever seen a little lab puppy, they're like, what? I can't hold still. Oh my gosh, you're awesome. So that's kind of the body language of that guy, really loose and wiggly. The other thing we look at is their tail. So their tail should be in a relaxed, neutral position. So notice how this is natural for a German Shepherd tail to be like this. Okay? It's hard to tell tail in some of our breeds that do not have a tail, like a Doberman or a Boxer, Rottweiler, that sort of thing. But you can also look at their nubbins, as I like to call it, their little knock tail, and see what that's doing. It may be wagging, but a wagging tail does not mean that I'm green or does not mean that you get to come and touch me. Okay? We'll talk about that in a little bit. The other thing, their ears are relaxed in neutral position. So this guy's ears are sitting on their body. They're not bent back. They're not, as I like to call, doing the disappearing act where they have them pinned so close to their body you don't even realize they have ears. Their mouth appears soft, so they may be open. It may be tongue just hanging out everywhere like a St. Bernard. Their mouth might also be closed, but they're really relaxed mouth. So it's called hard mouth, so they do not have a hard mouth. It's very soft and relaxed. Their eyes are really soft and relaxed as well. They're kind of, as I like to say, staring off into la-la land. Their eyebrows are really soft and neutral, and their pupil size is normal. Okay? So this is ultimately what we would like every patient to be when it comes into the hospital, a green dog. 9 times out of 10, they are not. Because in a hospital environment, everything they're smelling, so dogs and cats emit pheromones that we cannot smell. Those pheromones are telling them to run. This place is scary, all right? All the smells that they smell, so the urine, anal glands, that sort of thing, is telling them to run. This place is scary. They're going to do bad things to you. Okay, so hospital setting is very hard for patients, very hard for cats and dogs, because everything they hear, everything they smell, is telling them to run the other direction. Okay. Our yellow dogs. So this dog, I perceive this environment to be somewhat lethal. Okay, I say that word on purpose, somewhat lethal. So these are the dogs that know that something's going on, and they're like, what's coming at me? What's coming at me? What's coming at me? What's going on? Oh my gosh, oh my gosh, oh my gosh. So these guys are usually very tense. Their weight is shifted on the back, or they're low to the ground, like this guy, or like this guy here. The thing that they might do also that a lot of people misinterpret is they do this really submissive thing where they roll over and expose their belly. All right, and then a lot of people are like, oh my gosh, they want me to pet their belly, not looking at their other body language, and they bend over to pet their belly, and boom, the dog nails them. Okay, so you have to be really careful with that. The other thing dogs do, and it's very subtle, but they'll lift up a paw. I actually was doing a happy visit today with one of my behavior patients of Wisla, and she was sitting there doing this. And then she'd sit there and do this. And then she'd sit there and do this because she hates the hospital and she's very anxious in the hospital. Their tail is usually tucked or stiff. It might be wagging, but once again, like I said, a wagging tail does not mean come and pet me and love all over me. All right? They might have piloerection. Piloerection means that right along their spine, all this hair is standing up straight. Okay? Their ears are usually pulled back against their head. Like I said, the disappearing ears. That dog is a good picture of it. Their mouth are usually very hard mouth. Their lips might be pulled back. They might be growling, snarling. They might do this lip licking thing where they sticking out their tongue, kind of like a lizard. And they also might be yawning. Okay? You see this a lot in some small animal practices where the owners are sitting there in the room, and you see it here as well. And the owner's like, why are you yawning so much? You shouldn't be tired. You slept all night. It's not because the dog's tired. The dog is really nervous here and is telling you that it's really nervous here, all right, and not comfortable. The eyes, these guys are usually looking around for an escape route, okay? They also do this thing called whale eye, where it shows the whites of the eyes here, okay? So these guys, I say, are our flighters. If any of you worked with horses at all, horses are flighters. They are not fighters, typically. These guys give you all kinds of warnings and tell you, stop what you're doing, stop what you're doing. I'm not comfortable with this. I'm not comfortable with this. Let me go, let me go, let me go. They're trying to get away from you. They're trying to run the other direction. They're hiding underneath chairs. These are also some of the dogs you see where the owners are walking to the exam room and the dog's like kind of following them. And then all of a sudden they see the exam room and they're like, arr! And then the owner's like, come on, Fluffy, and dragging the dog into the exam room. That's a yellow dog, all right? So these dogs will give you tons of warning before they bite you. But they will bite you if you don't listen to them. They're screaming at you, stop what you're doing, stop what you're doing, I'm uncomfortable with this. And if you do not listen to them, they will tell you more directly by snapping, biting, growling, that sort of thing, all right? This is mostly we see is yellows. So a good thing to remember with the defensive threatening dog is they feel threatened and they're saying, I don't like that, stop what you're doing, we're just talking about that. This dog is avoiding a fight. It's running away from you. It's like, no, I don't want you to do anything, I just rather run away, like our horses. They just rather run away, okay? But the offensive threatening dog, so our red dog, which we're going to talk about in a minute, it's likely to become sorry. The yellow dog is likely to become offensive threatening, which is our red dog. So if you push the yellow dog, you can push them into a red, which we're going to talk about in a second, which is offensive threatening, which those guys are like, I know this place, they're going to do something to me, so I'm going to get them before they get me. All right? So you will never interact with these dogs when you're pet sitting because these dogs usually have their cages marked. They're sometimes wearing a basket muzzle. or they're sometimes on a sedation so that way they don't wake up. Okay? So our red dogs, we like to call them, so these dogs say, I perceive this environment to be lethal. All right? These dogs know something bad is going to happen or something is going to happen, whether it's good or bad, and they will get you before you get them. So some of the things that these guys do is they get really hard and stiff. They're really, really tense, but they tend to shift their weight forward because they're literally saying, bring it. Okay, that's what they're telling you, like this guy right here. Their tail is carried really high. I call them unicorn dogs because this guy looks like he has like a little unicorn coming out the top of his head. This is actually his tail there. And they're usually wagging. All right. The difference is they usually do this like little slow, methodical wag, where they're just like, oh yeah, come on, touch me, I dare you. All right. Usually erection is present, so that means the hair down their spine. Usually, not always. Their ears are usually erect and forward. Their mouth, they're usually growling, baring their teeth, or they're very hard mouth, meaning they're just super, super tight right there. Their eyes, they will do that hard stare. You never play staring contest with this dog. All right? I'm going to say that again. You never have a staring contest with this dog. If you do, that will tell the dog, I need to attack you. Okay? You are threatening that dog by staring it down. And when you threaten an animal, they will do what comes naturally to them to defend themselves. Either by attacking you, barking at you, whatever. You do not stare down this dog. Okay? Very, very dangerous. All right. So the thing to remember about all this, now that I've probably scared everybody with the red, yellow, green, is these dogs are only acting out of fear. All right? Here at the hospital, we do not like to say your dog is bad. We do not like to say we have bad dogs, we have bad cats. We do not like that wording because it's not true. All right? They're acting out of fear. They don't know what you're doing, what's going on, and so they do what comes natural to them, and they feel like they have to defend themselves. All right? Same way with you. If you were put in a weird situation or put in an unknown, familiar place, you had these weird, unfamiliar people touching you. If you're a no-touchy person, that that could send you over the edge. And it's all fear-based. You can't control that. If people are like clown, if they see a clown, it's like, you go running and screaming. You can't control that, right? It's just like an automatic response. Same way with these guys. They don't have control on how they respond to this environment, how they respond to fear. They just know, oh my gosh, I need to give them all kinds of warnings, and I need to let them know that I'm really uncomfortable, and if they don't listen to me, I need to yell at them, basically, or turn my volume up a little bit higher. So I like to really emphasize that because a lot of people tend to say, oh, they're a bad dog, they're a bad dog. I don't like that. They're fearful. Okay? So what we're going to do, if it's going to work for me, is we're going to watch a quick video. I don't know if you guys have seen this before. Have you seen this before? At least one? No, it's not going to say it. You're going to watch a quick video and tell me what happens in that video, what body language that dog is giving if it comes up. What is this dog doing? Color it out. Lip licking. Yep. What else?
Whale eye.
Whale eye. Ears down. Yep. What is it doing?
Looking at them.
Yep. What else did it do right there? Bird gaze. Yep. I don't know why we don't have sound. That's just the guy telling you that I don't know why this dog did this. Oh, God.
Slow-mo.
I know, don't you love the slow-mo on this? Did you see this? You're like, stop! We're going to talk about our body language in a minute and why this was not good.
Oh,
There you go. Was that dog giving warning?
Oh, yeah.
Was that dog screaming at that guy? Leave me alone, leave me alone, leave me alone. Right? You guys caught all that? See? Now you guys are going to know. Yes, he kept going closer
I
and
would've
closer and
said
closer. All right, watch this guy, see what he does.
Come on, dress, buddy. Dress. Hey,
What's he doing?
we don't do that. Dress. We don't do that.
Yep. What's he doing there?
We
Yep.
don't do that. Hey, we don't do that. It's okay. Hey, we don't do that.
Where's his body? Where's his weight
We
shifted?
don't do that. Hey.
If he had a tail, where would it probably be? Now, would you consider him a yellow or a red? Yellow. So he's yellow going into red. So that dog is giving you all kinds of warnings, and he's pushing them to make him bite. Okay? See, I told you guys would be experts. Oh, where are you going to start? There we go. All right, so what do you think about this dog? Red, yellow, green? Yellow. Good job. What makes him yellow? Whale eye. What else? Eyebrows. Good job. What else? Mouth. Good job. What else? Ears back. Good job. See? I told you guys would do this. Red, yellow, green. Yellow. Yes. What makes him yellow? Tail tucked. What else? Lip licking. Weight. Yep. Yep. So this is somebody that's trying to get a dog on the scale. You guys see that? The scale is scary. The scale's really scary. It's a big black hole you're asking them to walk on. All right? So it can be very scary for every dog and cat out there. All right? So when you get into vet school, you'll learn a really fun way how to get patients on the scale. All right. This is a challenging one. Red, yellow, green. Don't look at the breed. Look at the body language. Yellow. Good job. A lot of people see Labrador and they automatically say green. Why is this dog yellow? Hypersalivating. Yep. What else? Staring. Yep. What else? You have to look really closely. Eyebrows. What else? Huh? I think that's him. Here? Is that what you're talking about? Yeah, I think that's just him. He's all drooly and a hot mess. What else?
Hard mouth.
Hard mouth, yep. What else? You have to look really closely. What do you never want to do to a red dog? Stare them down. What is this dog? Look at this dog's eyes. One is...
Two different size people.
There we go. One's dilated, one's not. Remember? Dilation in our yellows. That one's a little bit tricky. I thought I'd throw that in there. What about this one? Red, yellow, green. There's a person, I should show you. There's a person standing here. This dog is facing a person. Red, yes. That dog is staring that person down. This picture was taken from the side, so it's a little bit harder. Hard stare. What else do we see? Body weight shifted more forward. What else? Eyebrows, lips, yep. He is saying, literally, if that person over there would move, that dog would attack him. Him or her. What about this guy? Everybody assumes it's the big guys that are always the challenging. The little guy in there. Red, yellow, green. Yellow, yes. He's kind of tough. He's very tough. What makes him a yellow? He's baring his teeth, yep. He's probably growling, I can assume. Ears back.
Staring directly.
He's not staring directly at the person, correct. He's staring off, so it's called averting gaze. All right, so he's like, yeah, try to pick me up. All right, so we're going to quickly talk about our body language versus their body language. This is really important for you guys. This is how you guys are interacting with these patients, all right? So our body language in the human world is very direct, correct? Right? If we see someone new, right, what do? Hi, I'm Jennifer. Nice to meet you. What kind of body language is that? Or what kind of approach is that, I should say? Direct approach. So I walked straight up to Rebecca here, correct? I looked her in the eye, and I stood right in front of her and reached out to touch her, and expected her to touch me back, and it was in pretty close proximity to her. All right? In the human world, that's acceptable, correct? Was it appropriate way to greet Rebecca, correct? And that is a direct approach. In the animal world, not so much. That's not how they approach each other. In the animal world, they do what's called an indirect approach. So if you guys have ever been to a dog park and you've seen the dogs that are like, oh my gosh, and do the little play bow where they make themselves a little bit lower than the other dogs, or when they sniff each other, they sniff each other's behinds and they go like in a circle. They're not face to face, all right? So these guys are doing what's called an indirect approach. They're kind of sniffing each other, they're side next to each other, they're not facing each other directly, all right? This guy is doing another where I'm going to make myself really low and not scary and really cute so you come over and play with me, all right? This guy, not so much. Face to face, nose to nose contact, straight on, all right? And you can see how that's greeted. Not well. So an indirect approach when you're greeting a dog is, and we see this all the time. So most people say when you greet a dog, what do you want to do? Walk up to a person and say, hey, can I pet your dog, right? The person typically makes their dog sit, and then you go pet, 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 pet. Correct? I was thinking about petting on top of your head. You go pet, 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 right? Right on top of their head, correct? That's typically how most people do it. Now, those that know better, what do you want to do? Do you hold your hand out?
Not supposed to.
Okay. Yes, people do that. So that's another thing that a lot of people like to do, and even our vet students do that here. I'm sure Olivia will tell you. They do it all the time, and it's like, why do that? Another thing is, if you don't like being touched on top of your head by a stranger, neither do they. You don't like somebody's hand in front of your face, neither do they. All right? So what we want to think about is an indirect approach. So indirect approach, if you really want to pet this person's dog, would be stop prior to getting next to the dog, all right? We turn our body to the side, because when I turn my body to the side, I am much smaller, correct? When I'm like this. So I'm much smaller, not as threatening, and then you want to bend at your knees and go, here, here, and if they want to interact with you, they will come over, and then you can pet them. Where's the appropriate place to pet a dog? You guys know? Top of the head? No. Neck. Side. Right? Really not threatening there. And I'm not meaning like lean over like that police dog guy, and for some reason he had two hands around that dog's neck. Straight, bend at the knees, pet them. No leaning over. Okay? So what do you see here? Let's pick on this guy. Do you think this dog is enjoying this?
No.
What makes you say that? Yeah, he's trying to get away. He's like, oh. Why do you think he does not like this? Is this direct or indirect? Direct. What makes this direct? He's crowding them, he's right in front of them, and he's also doing one big thing a lot of people do. Bending over the dog. Alright? Would you like it if someone just came over to you and just bend over you and talking to you like that? No, neither do they. That's really threatening. Very threatening. Okay? What about, I always pick on this, and I have a child now, so I can pick on this. Hugging dogs. Children hugging dogs. Is this dog enjoying this hug?
No.
What makes you say that? What is this dog doing? Trying to get away. He's looking up, so averted gaze. I'm assuming if I were to sit over here and take a picture, I would bet this dog has whale eye, too. He's very stiff as well. What is she doing, direct or indirect? Direct. Dogs don't like hugs. All right? 9 times out of 10, they don't, and a lot of people don't like hearing that. Right? Because that's how, in the human world, that's how we show we love you, we give you nice big hugs and kisses, right? Most dogs do not appreciate that. Okay? They did an article, they released it a couple months ago. I don't know if you guys know. It was like on the Today Show, everywhere. Dogs don't like hugs. But it's a really good article explaining why not. All right? What about this one? She's trying to be good and give this guy a treat. Is this guy liking that? What do you think? This is a tougher one. Look at his ears. Where's his ears? Back. Yes, good job. That tail's up. That is going to be a yellow dog right there. All right? Is that a direct or indirect approach? Direct. What is she doing that's causing that to be direct? She's right in front, she's reaching out, and she's also bending over. Okay? See, I told you guys would be experts in this. Alright, so we're just going to do a quick how to do correct body language, or non-threatening approach, it's called. This is our one and only Dr. Megan Heron. Labrador, everybody loves Labradors. What did she do there? She's kneeling down, she's bending at the knees, not at the waist. She turned her body where?
Sideways.
To the side. And then she's just kind of encouraging the dog to come over. This we actually use for students to show them how to do an exam. Notice she's petting under the chin, not on top of the head. And for exam purposes, we're now showing you how she's able to look at the dog's teeth, look in its ear, that sort of thing. All right, so that would be our non-threatening approach. We want to turn to the side, we're going to bend at the knees, and we let them come to us. Okay? All right. You guys comfortable and confident? Got this, right? All right, so do you want to talk about cats real quick or not? You're not going to see very many cats. It's 6:30. We still have to do a tour. It's up to you guys. Yes, no, maybe so? Are we comfortable with just dogs? Or do you want to really do cats? It's up to you guys. Nobody's giving me a straight answer. All right, how about we do the tour then?
Okay.
That way everybody can just go home and